Hello, I'm Dr. Helen and I'm a GP in Staffordshire, and I'd like to talk to you about fever, that's high temperature, particularly in children. Now, fevers are really common in young children, usually associated with viral infections, and they can be really frightening when your child is terribly hot and terribly distressed as to what you should do next. But I'd like to reassure you that most fevers are very safe to treat at home and pass without complication or incident. It's really important with anybody who has a fever to keep well hydrated, so that's lots of fluids, plenty to drink. Often room temperature drinks are the most comfortable, but cold drinks if people want them. And for very young children who are still breastfeeding, then keep offering them breastfeeds. They may feed less than usual, but every little feed is giving important fluids into their system. People get excited about sponging children down and removing all their clothes, and we know that's not necessary. But of course, don't overload children with too many clothes if they are hot and bothered. You can always ask a local pharmacist for advice if you're not sure, but medications like paracetamol or Calpol in children are really helpful at bringing temperatures down. For other children, ibuprofen works just as well, and most children we say stick to one or the other. Of course, there are times when children will need to see a doctor or other healthcare professional with a high fever. If your child has a fever of over 38 centigrade and they're under 3 months old, please let us know. If your baby is 3 months to a year and a temperature of over 39 degrees, we still want to know. But otherwise, do try the self-help things first. Plenty of fluids, paracetamol or ibuprofen, and remember that the virus will pass very soon. If you are worried though, you know your child best, so do still pick up the phone and call us. That's either calling your doctor's surgery or calling NHS 111 for advice. Rashes are something different. And of course, we're always concerned about serious rashes, so if you do see a child with a rash that doesn't disappear when you roll a clear glass over it, then we do want to know about that as a matter of urgency. But overall, most fevers are minor, they're very common, and they get better on their own.